And we're recording, and today, July 13th. Wow, hotter than July. Definitely a hot one. So welcome to today's Natural Healing Study Group. I'm Carrie, and there's Robert Bro. And today, we've got a really fun, I think it's fun because it solves a lot of mysteries, and we're going to kind of give you some little minute mysteries near the end of different things. But we're going to talk today about what is the common denominator? What do all of these things have in common? Neck pain, or limited range of motion, TMJ, clicking or pain or limited motion, and what else did I put? Carpal tunnel, the whole carpal tunnel outlets, that's the problem with that, and what they all have in common. And want to give you a little bit of perspective from our point of view. So if you're, if you have someone who has the symptoms or has the problem, you're looking at it like, over this way, wondering, oh my God, is it a bone cancer? Is it COVID? Is it, who knows? You're thinking, oh my God.
Worst case scenario.
Yeah, is it whatever it is. So from our point of view, I'm going to try to give you an inside point of view from a clinician on how we look at things and how we, classify it. And everybody's got a different thing, a different way of looking at it, but we've been doing this together for over 30 years. And, we've seen a lot of patterns, over time, you just start to correlate things in patterns and make things easy. You don't want to reinvent the wheel on every patient you see, or think that it's, oh my God, what is this weird thing? You see these commonalities and you start to learn, certain things to clue you off. So from a clinician's point of view, first of all, listen to the person, listen to their symptoms, make notes, and then I observe them. I observe muscles. A lot of what we're going to talk to you today, and we're going to talk a lot about physical today. I mean, we have to take in the whole body, the spiritual, the mental, the emotional, it all fits. But today we're going to talk a lot about the physical because it just makes sense when we break it down. But when we look at something, we can see from our point of view the distortions. We know how it should be, and we see how it isn't. For example, if somebody is standing and facing you with their arms hanging down in anatomical position, the hands should be in a certain way. If the arms, are rotated and the hands are like this, or one hand is this way, they should be like, this in front. But if they're like this, I'm doing it so you can see me, but standing. But then, I'm going to just see that that's distorted. It's like the body at rest should look a certain way. When it's not, I'm going to see a muscle imbalance. Or if I watch somebody walk, is there a, kind of a movement in that? Or is their head not level? I mean, I'm not sitting there like this, but if somebody's straight and all of a sudden, you see this happening, like, it looks like the head's like this and the shoulders are like this. Those are things that should clue you into what muscles are tight. And then you should opened up that box of solving the problem, of the little minute mystery, or that's why I call it minute mystery. But that person and what they're presenting with is what the body's trying to tell you. It's what the body is saying. Look, this is wrong. This is off kilter. It's out of balance. These muscles are affected, and these muscles affect the spine, and these, the nerve flows to the spine and communication. So just from that, you start to see it from a different point of view. So
I'd like to add to that too.
A little warm up. So go ahead, Bobby.
I'd like to add to that. People, we see the body a lot differently than other practitioners, maybe, where if you have this distortion pattern, you have a side that's tight, people always want to go and try to loosen the tight side, and what it is what's weakening the opposite side to make that appear tight. It's not being kept in balance. So there are conditions that will weaken a muscle, and then it upsets the structural pattern because you don't have the symmetry and balance anymore. So the way you interpret what you see, not just seeing those distortions, but interpreting it correctly to know how to address it properly and get relief for that person quickly. So go ahead.
Basically, that's it. I wanted to just give you a little overview of where we're going today and our perspective. So you're going to step inside our minds, you know, the clinician's mind, looking at some of these disturbances and starting to make sense of things and seeing it like a puzzle and how to fit it and piece it all together. So hopefully you'll enjoy this. I'm going to let you start, Bobby, because you've got the meridians and we're going to give you the kind of the over pattern.
All right, so we're talking about neck issues.
TMJ and the carpal tunnel is
Okay,
our.
so in applied kinesiology, there are relationships in the body. Every skeletal muscle is related to an organ system or a gland system in the body. And we test many different muscles that represent different parts of the body. And some will be strong, some will be weak. And so we have to be able to take all that feedback the body's given us, interpret it properly. But I just want to share with you, and this is the stomach meridian. So we have 12 different meridians. These are energy highways on the body, kind of like copper traces on a circuit board, if you will, that communicates information in the body. There's one on each side of the body. This is just showing one side. But these are pairs of meridians. So the stomach meridian starts right under the eye at stomach 1, and then it goes down to the foot. The solid line is on the surface. The broken lines are deeper in the body under the skin. And so it goes all the way down to between the second and third toe on the lateral edge of the second toe.
Remember that, people. So remember those second and third toe, because I want to talk about that. I think I was starting to talk before the call, but remember that. And then remember on the face that it starts under the eye and it goes through the sinus. So just keep that in the back of your head.
And then also, while we're looking at this, notice how it goes right through the breast. And anytime you cross one of these meridians in the body with metal, you stop the flow of energy. So think about a underwire bra, the wire going across that meridian right there, stomach meridian. And you know, a lot of people don't realize that happens, but on the head here, it could be like a metal barrette, it could be eyeglass frame, the part coming back there. So.
And it goes through the TMJ area also, remember that. Yeah.
So any reconstructive surgery, screws, plates, and things like that can affect these meridians. You know, people, they don't look at that stuff. So with stomach meridian, we have correlated muscles. There's a bunch of them for the stomach. Now, these are all cervical muscles in the neck, right? The splenius capitis, semispinalis capitis, longus capitis, splenius anticus, sternocleidomastoid. These are all in the neck. Longus coli, scalenus medius, semispinalis cervicus, splenius cervicus. Okay, a bunch of them. And then in the shoulder.
Hold on one second. Just in the neck, notice that some are, I mean, you probably don't know the anatomy, but that's okay. But you'll notice some are in the front of the neck and some are in the back of the neck. Both. Okay.
Right. So the shoulder, this levator scapula, see that on the back side of the neck? These are on both sides. The pectoralis major clavicular, which is right by the clavicle here, collarbone. And then going down the arm, you've got all of these muscles all the way down to the hand. These muscles in the hand that oppose the thumb and different things are all on the stomach meridian. They're all connected to the stomach meridian. So
and by the elbow too, connecting
right.
The hand, you know, going
Yep.
the hand and up to the elbow there.
Now, there's more. All the muscles of mastication,
Chewing.
right, are all on the stomach meridian. So when these get weak because there's a problem with the stomach, say, or it could be a tooth on the stomach meridian, creating a feedback. When these muscles get weak, you get imbalance because muscles attached to bones. And it could be bilateral on both sides or unilateral on one side. But here's your TMJ problems that many people have are caused from these muscles being imbalanced because of problems in the stomach. And rarely is that correlation made. Also, craniosacral issues with all the bones in the cranium. So this is stomach meridian. Okay. Now let's look here, pronator quadratus, and
In the hand.
the ones that connect to the radius, the brachialis, the supinator, all of these contribute to symptoms that get diagnosed as carpal tunnel syndrome, tennis elbow, rotator cuff, shoulder issues. There's these catch-all phrases that orthopedic people like to use, and they, oh yeah, we got to do rotator cuff surgery on you. Which muscle is involved? They don't know. They just say, oh, rotator cuff, we got to go in and do surgery.
We're going to go in and scrape the inflammation off of there.
Yeah, and create scar tissue.
Scrape it. Scrape the arthritis out of it.
Yeah, a lot of these symptoms are caused because of problem in the stomach. And it's not getting credit for that, right? So think of all the people that have neck, shoulder, elbow, wrist, hand issues. They can be coming from, I don't know if you remember the tooth meridian chart I think I showed you last time or the time before, where each tooth has at least 2 meridians associated with it. So in embryology, when we're developing as an embryo, our face and mouth develops first, and then the rest of the body develops. So there's a energetic connection, meridian connection to the teeth, and anything that happens in the mouth can feed back to those associated organs or muscles in the body and cause all kinds of symptoms. Also, along these meridians that you saw that was running down the body, and this is just one of 12 meridians, mind you, but you can have symptoms show up on those meridians also. You can have lesions, you can have pains, you can have warts and tumors and things that manifest along those energy highways because of an associated problem with something else associated with that meridian. The tooth could be root canal on that meridian. It's causing all kinds of symptoms. But, basically, the neck, all those muscles are affected. So first thing we do when somebody's got problems with the neck is check this stomach for hiatal hernia, first of all, because that's really common, especially with the high stress lifestyle that we all lead. When the cardiac valve above the stomach is not closed, it's often because the nervous system that controls it to keep it closed gets turned off when you're under a lot of stress. The parasympathetic part of the autonomic nervous system, or the vagal system, it's also called, or the vagus nerve. So that gets turned off, and then the valve doesn't stay closed like it should, so it opens up. And this is right in the diaphragm where the esophagus passes through. So the stomach can get pushed up into that open valve, and then it spasms and it gets stuck there. That's called a hiatal hernia. Now the body interprets this as an injury, so that feeds back to your adrenal glands, your stress organs. It causes a sympathetic response to that, which would further turn off the parasympathetic.
The
So
fight
you're not
or
going to
flight
be
is
able to,
activated.
right?
Yeah.
Because you have an injury. So that's going to really impair digestion, elimination as a whole. When you're in sympathetic dominance or fight or flight, you can't digest. Your stomach doesn't function like it should, especially if it's hanging in your diaphragm muscle, your major muscle of breathing. So that can manifest as all kinds of symptoms in those stomach-related muscles. Often neck pain, something you can't stomach in your life, something being a pain in the neck to you or something. There's all correlations with these old sayings and conditions, but yeah, the stomach affects our ability to break down proteins and to utilize minerals in our diet. And if it's not able to do that, we're going to have a lot of problems with making 1 billion cells every hour like our body should do. Just normal function, making hydrochloric acid so you can break down your proteins and minerals. So when these aren't working right, these muscles get weak or there is an imbalance created, and that creates problems with the cervical spine with these misalignments. So you get spinal cord tension. You can see with all these muscles attaching to these vertebrae, so it creates a misaligned atlas for one thing, your first cervical vertebra. It can pull on ligaments like the dentate ligament that suspends the spinal cord. And that'll cause abnormal tension on the whole spinal cord, just from that happening at C1 there. It can affect venous drainage and compression of the jugular vein in the neck, and the vertebral veins restricts blood flow out of the brain, causing increased pressure in the head. You get headaches and stuff.
Can't think clearly.
Misalignment. And arterial supply. Tension on the vertebral artery can restrict blood flow to the brain, causing a decrease in oxygen and nutrients to the brain. I think a lot of people have that problem. Cerebrospinal fluid flow. So the cerebrospinal fluid flows around in the brain and through the whole spinal cord all the way down. So it can cause fluid buildup, back pressure, which can cause headaches and all kinds of nervous system symptoms. Affect your balance. If you have upper cervical misalignments, it can disrupt nerve signals to the balance center of the brain in your cerebellum, altering your posture control and your gait mechanism, all kinds of stuff. So when that happens, you can trip easier and fall and break a hip or something, especially if you get older. You know, these things, one domino hits the next domino and they start falling. So stress and imbalance in signals going to the brain can put the brain and body in a fight or flight status, mimicking chronic stress, just like Wi-Fi, cell phone in your pocket, artificial lighting, all these other things that can put you into that fight or flight mode. Stimulate the paraventricular nucleus, which is the start of the sympathetic nervous system, the fight or flight nervous system. If you're in pain, connections between the muscles of the upper neck and the covering of the spinal cord become tense, creating pain at the base of your skull. Tension headache. And altered function, direct nerve pressure from a significant misalignment can alter nerve signals between the brain and the body.
And remember last week that we talked about, when we were talking about low back pain, that there's the relationship, the love it brother relationship. So if you have a lower lumbar, you know, say L5, you know, it's going to reflex back up to the top, you know, and be opposite, you know, the C1 area. And then C2 will go to L4 and then back and forth. So, you know, if you have a misalignment in your neck, you're going to have a misalignment in your low back. Or if you have the low back misalignment, then you're going to have the neck misalignment. They have to go together. You can't really have one over the other. One will be more primary, but you'll almost always find that. Sometimes one is, you know, more severe, but it's going to affect that because you have to walk, and the body has to do that to be able to walk. So again, from our point of view, you know, we're going to check that too. So a person has neck pain, we're also going to make sure that you know, you should check that low back correlation also.
Can you see this?
Yes.
Health and sickness.
But you got to open it up. They're just there. You got to click on them.
Oh, it's
They're,
okay. I'm sorry. Let me try it again. Can you see that now?
there it is. Yep.
Okay.
There you go.
So in health, you have balance. Head and neck are aligned. You can see this image, the symmetry and balance. When the brain health and healing messages can flow to all parts of the body without interference, you may expect good health. In sickness, see with this atlanto-occipital maladjustment here, misalignment with the head and the neck, then the brain health and healing messages can't flow to all parts of the body due to interference at the point where the head and neck join. You can expect health problems to develop. And thought this was funny. Candy canes.
Yeah, it's cute.
Yeah. So subluxation in the neck, these vertebrae get out of alignment, impinging on the spinal cord and spinal nerves, where they come out of the spinal cord. And they can rotate, they can move laterally or anteriorly
Toward
toward
the
the
front,
front
like coming like a drawer, like you would open a drawer,
or posteriorly.
pushing it back.
So you can find out through proper applied kinesiology muscle testing which way it is out, and then you'll know the correct line of correction to fix it, which is cool. So when this happens, often it's secondary to an imbalance of musculature
Mm-hmm.
coming from an issue affecting the stomach. And interesting.
And then it's sympathetic dominance, or you're in the fight or flight. So again, we
Right.
want to calm that down, turn off that overactive sympathetic, turn on the parasympathetic nervous system, start restoring function to the organ or that's screaming. Like here, you know, the stomach would be screaming, you're like, something's wrong. And, you know, the person comes in with neck pain or like TMJ or, you know, all these symptoms. Right. So, you know, we start helping the stomach, getting them talk, sometimes letting them get things off their chest. It's like, oh, God, so-and-so, it's just a pain in my neck, blah, 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 blah. You know, you have to get all this body, mind, emotion stuff happening. But then, you know, we want to start thinking about the muscle misalignment, the nervous system, getting that's like first thing, you know, in our minds, you know, getting that sympathetic dominance turned down. So that way the muscles can relax. So the stomach's valves can be in their proper receptivity. So we can, you know, the stomach can get put back in place. All of that can start, you know, to be unwound. Then a lot of times the body will correct itself. You know, a lot of times it will put itself back. You know, a lot of times now it won't, because we have, you know, we're so tense and we're so armored and we're in such a Wi-Fi laden area. The body, even after a good proper night's sleep, has a hard time doing that. But anyway, it's still possible.
All right. So get out of here. Yeah, all those things have to be addressed, and then what we do when we're testing, you could therapy localize to the neck, so we could just hold where the pain is,
Yeah.
and then say that causes previously strong muscle to go weak, and then you can have them touch, or the tester can have them touch thumb and index finger together. If that makes that weak muscle get strong, then we know that it's strictly structural.
Structure.
If it's middle finger and thumb that makes it strong, it's biochemical. Then you start looking at nutrition, toxicity, things like that that can be the cause of that. And if it's ring finger and thumb that makes it strong, then it's electromagnetic, and it could be also psychological, could be emotional issues. So the body will prioritize, and whatever shows, you approach it that way. and you try to, you know, instead of just going to where it hurts, well, if it's biochemical, do we have enough hydrochloric acid being produced in the stomach, for instance? And you can do tests for that. Check the pectoralis major clavicular together. If they're strong by themselves or weak together, that's a test for hydrochloric acid production in the stomach. The pectoralis major clavicular is related to the stomach
I'll show
meridian.
you that in a second when I share my screen.
Carrie's going to cover that. Okay, so things like that, you can find and unravel that pattern based on what they show in the muscle test. And if it's structural, then but you know what we do is we'll work on reflexes to restore parasympathetic, to turn off the sympathetic, to turn on the parasympathetic, which should be driving the stomach and the whole digestive system. And then with the table, we put frequencies on that will relax all that, put them into a more chill, parasympathetic mode. And then the body, if the body doesn't correct itself, you can correct it a lot easier without having to fight all that, the body's armoring and trying to protect itself. So you get the body to, you peel a few layers of the onion, and then it's so much easier to make these corrections. But
I think that's one reason why maybe people don't like their necks to get adjusted. I mean, it's a smaller area, but sometimes it's all tense, you know, and then you've got to, you know, the chiropractor has to overcome all that, you know, tension, and it hurts.
Mm-hmm.
So if you can restore function to the body, help turn on the parasympathetic nervous system, turn off the fight or flight, you know, get rid of this stuff starting to happen, then it's, you know, that muscle tension can be relaxed. And again, a lot of times the body will restore a lot of its own alignment from that point.
Right. And if it's coming from, say you got a tooth, or you got a broken tooth, or a root canal that's inflamed, you got abscesses, even periodontal infections, that can override, and it can cause all this response in the neck, shoulders. I mean, it can be anywhere in the body, but a lot of it manifests close to the teeth. And if that's not handled, and you just go and adjust them or correct them, and then they get up and walk, they're going to go right back up because you have the same muscular imbalance created from all that. So you got to handle the cause, not just chase symptoms. That's an allopathic approach. And you know, even though you're not using drugs or surgery, you don't want to chase symptoms. You want to address the cause, but ideally give symptomatic relief in the process. But
yeah,
we want to go to the cause and then tie the knot that's creating this tension. That way, you know, it almost corrects itself. So understanding those relationships is important. But if you get them, you know, like on the table, rub these reflexes. There's one right over the left breast, right in line with the nipple, and you rub that clockwise for 30 to 60 seconds. That brings more parasympathetic nerve flow to the whole stomach and restores normal function. Turns off that sympathetic fight or flight that so many people are stuck in. Now, if you're doing this kind of work in a clinic where you've got junk blue lighting, you got Wi-Fi, you got your phone in your pocket, you got a laptop computer, right? You know, they're going to put them into that same mode from the effects of all that. So you got to have a clean environment to clear this stuff out. That's why it's so important to pay attention to this in your clinic, because otherwise you're going to get somebody that's living in the same environment, and they're coming into the same environment in your clinic, and then you're exposed to all that, and the therapy is only as high as the therapist. So
I think you get inconsistent results. You know, you get some relief, but then it can go back. Some things, you know, of course, you give some relief on something, but then it depends on your integrity and what you do, but then how quickly it can come back. So I want to
trying to get someone out of sympathetic dominance,
right?
And you got fluorescent lights, and you got these influences that are putting them back into sympathetic dominance, fight or flight, survival, constantly, they might get relief for a few minutes, but they're still in that environment. Then they go out to their car and it's got Bluetooth and, you know, all these invisible influences that put them back into that fight or flight mode. It's going to tighten up. Then they lean in the back seat to get something, and oh, it's back out again. Or they reach in their mailbox and, you know, on the way home. And, ah. So you got to address all of that to really get lasting results. Otherwise, you're really sticking your neck out.
I'm going to share my screen here. I'm going to show you something.
Sure.
And go here. This is one book that we really like. I'm just showing you this one too because it's an easy, I took some pictures of it so I can actually show you from our point of view. Can everybody see that? You can see that okay?
Yeah.
Okay. So this is Manual Muscle Testing, a Practical Guide, Applied Kinesiology by Dr. Robert Morrison. It's a great, great book. But anyway, I'm just going to show you a few, and I won't blow up these, but I just want to give you, these are all on the stomach meridian. Bobby showed you, I don't know how many are there. 25, 30 of them, maybe more, 40. But anyway, this one's the biceps muscle, bicep brachii. And then here it is. It has, you can see it has the long head, the short head. One of the things I noticed about this is, you see this says tendon of the long head. That will come right up here. And then this bone here that it goes over, it's got a little groove in it that this tendon sits in before it actually connects back up into, you know, the coracoid process. But over time, from maybe abuse, doing something, pitching baseball, overhead tennis, racquetball, you could see just like if you extend your arm up how easy this tendon could fall out of place. And then in time, when if you have nutritional deficiencies, stretched ligaments, tight, you're dehydrated, these don't even need to be throwing a fastball to fall out of place. You could
Put your
reach,
shirt on or something.
put your shirt on, you can reach in the back seat, out the window, and boop, that little sucker goes out of the groove. Oh my God, does that hurt? And it can't, I mean, if it's out of that groove, you restrict motion. You can't now lift your hand up. You can't lift your arm up like this. My God, you can't even brush your hair or anything. And then there's levels of it going in and out of that groove. I mean, it could be completely out, it'd be a little bit out. It was just, you know, it's all wonky depending on the person and their own anatomy. But anyway.
It can go lateral or medial.
Or yeah, one way or the other. So, and then that tendon can get stretched because then nobody's ever going to find it. And then here we go. Here we go. You got to go get rotator cuff surgery, rotator cuff, straighten up, you know, and it's just this dang little tendon that's out of the groove that nobody knows how to put back in. Simple, simple. It can be done in like 30 seconds. 30 seconds. Fix this. And then you just have to, of course, tell the person to keep their arm by their shoulder a little bit, maybe a little hot and cold, some magnesium just to tighten it up because it's all inflamed. You know, do some things to take the inflammation down. But yet, that's the problem that they might come in with. But then our think now is to go, well, what's going on with your stomach? Because if we look over here, you know, this person would be complaining, slip bicipital tendon, bilateral weakness. It could be a hyperinsulin problem, the radius, which is the elbow joint. Okay, they could have difficulty or pain on the elbow flexion or the forearm, you know, moving it this way, like difficulty like using a screwdriver or opening a door or something like that. So those are some symptoms that would clue you into that muscle. I should have showed you what these things are first, but anyway, acupuncture meridian association, what Bobby mentioned before of the acupuncture meridians. I'm just going to show you these, and it'll say stomach, and then it says common subluxations. The vertebra goes out of place. Just think about a subluxation is a vertebra going out of place. And it's telling you exactly where it's going to be. Look at C5, C6. Won't worry about this at the Merrick line at the moment. And then it also tells you an associated point that is also associated with the acupuncture meridian, and it's telling you thoracic 12, T12, and L1, and it's a stomach associated point. So you could probably find sore points right on either side of the T12, L1, and they would probably be out of place as well, because it's the opposite, you know, that love it brother area there. And look
So
again,
the C, in case they don't understand, the C is cervical,
cervical, sorry.
first 7 vertebrae. Then the T is thoracic, which is 12 of those, right? One for each of the,
Middle.
for the ribs that attach. And then there's the L is lumbar, which are the 5 lumbars, right? So
Right.
that's what those
Yep.
stand for.
So, and then it's telling you the visceral association, stomach again. Okay, so we got it, and I'm just gonna pick on these because I want it easier to show you. Here's the neck, medial neck flexors. These are the ones here. You can see they're on either side, and these are in the front, and it brings the neck toward the front. It's like if I wanted to yeah, bring my neck forward toward the front, looking like down. That's the bringing of flexing. Now, check this out. There was just showing another picture of it, but here we go. Oh, I didn't show you the nutrition on the last one, but I'll show you on this one. Actually, what I do before we go too far, I want you to see that because I didn't show it to you. Okay, so the nutrition on that last one, betaine hydrochloride, which is a substance that your stomach makes to digest, you know, hydrochloric acid. So this is what you would take externally. We've talked about that. And this is also saying duodenal substance, chlorophyll. Chlorophyll is high, and it's, you know, the greens, and it's high in magnesium, and it's got the copper molecule in the middle. Okay, so interesting. Let me back over here now. Okay, so here, this one with which we started with our neck flexors. So we're indicating some B vitamins, B6, niacinamide or niacin, organic iodine, and then this is indicating sinusitis. We'll talk about the sinus here. The visceral association sinuses, acupuncture meridian, stomach, common subluxation, upper cervicals, and then associated point, the 12th thoracic and the L1, because it's the upper, those cervicals, and those relate. So those, again, are stressed. Somebody's coming in with neck pain. Now, neck extensors are the ones in the back. That's when you move your head backwards, like when you're looking up, you know, those ones in the back are flexing, and that's making your head extend. So those are, here we go, you can see those a lot differently. All of these up here are the cervicals, and then we're starting into the thoracic, going down this way. But here, what else I want to show? Okay, whiplash injury, these could be. Also, if they're both weak, it could relate to the lumbar fixation. The lumbars are stuck together. Well, that would make sense because, you know, these are supporting this upper neck over here. And then we told you that opposite, I don't have a picture, but you got to imagine on the very bottom, the sacrum, the lumbar area, that's going to be opposite of that lumbar area. So if this is all tight and constricted, it's going to reflex and make that lower back tight and constricted.
That's
so,
the beloved brother relationship we talked about. The first 3 cervicals and the last 3 lumbars, they move the same direction to compensate for each other. And in between that, they move in the opposite directions to create balance, to compensate. So that cervical could be caused from the lumbar being out, but that wouldn't be stomach related.
And then here again, you know, we've got the extensors here, common subluxations, cervical spine, and then associated point, the T12L1, same area, stomach, and then the visceral association sinuses. Now remember, I told you to remember a few places on that meridian, and then when I'm actually done with this, maybe Bobby can put it back up. But one of the areas that goes through, that stomach meridian goes through the sinuses. You know, it starts under the eye, like Bobby said, and then the sinuses are right there. So it's going to inherently have an association with that. And then as well with the TMJ. So this is some of the stuff we're talking about. I think I got one more here. The pectoralis major clavicular. So this is, you know, this is the breastbone right here, and this is the clavicle, and then this goes out to the arm, the humerus, or, you know, that part of it. And this is the one that we like to test for actually testing the stomach. But here it is, better picture. But now here, throwing problems, emotional stress, B vitamin deficiency, GERD, you know, any kind of digestive upset that somebody's gonna be talking about. H. pylori, you know, you can pick that up here. And then bilateral weaknesses are going to be associated with allergies, a need for hydrochloric acid, and then it's talking about cranial faults here. Oh, while I've got this up, this book is definitely, Dr. Morrison was a student of, as we are as well, Doctors Walter Schmidt and Carrie McCord, who put together a fantastic program called Quintessential Applications. And it's a applied kinesiology clinical protocol. And Bobby and I are both certified in this. And it's a fantastic system. I just had to give these guys a little shout out and credit because they put together a ton of great information that was, they kind of stood on the shoulders of George Goodhart. There's a few other people. I'll have to do a whole show on kinesiology and the backgrounds of it. But I just had to mention it before I got too much off there. But anyway, this muscle here, our pec major clavicular, you know, we've got problems. So if you're seeing it from our point of view, you know, somebody comes in with the stomach situation and then they say, you know, they can't throw, or they're, you know, they can't do something with that arm, or maybe they have trouble combing their hair, you know, or putting something up in the cupboard. They're emotional wreck. They're having trouble digesting. And then you should just automatically be thinking this stuff. Or if they're having, and you ask them, do you have some allergies? Oh yeah, and my sinuses. And it's like, you'll just go, okay, got it. So here we go, stomach again. Look at common subluxations. C5, you know, cervical 5, 6, and 7. Associate point, the opposite again, T12, L1. Do we see a little pattern here? And then here, more betaine hydrochloride. B12, B and G factors are just part of the B complex. So I think that's all I got. Okay, here, and then let me just show you. Here's the pec major clavicular, the posture. So when you're standing forward, your hand should be here, like on his right hand. Now you'll see this, his left hand, it's starting to rotate a little bit. I can see his palm. Okay, so it says here, the palm will either face, or face forward, or in less cases, it will rotate, externally from the frontal plane. So it's just going to be more, you'll see more of the palm of his hand when he's standing there. So first thing you should do, somebody walks in your office, or you're just noticing, your friends or family or something, when they're standing there, you see their arms, you can watch their palms if they're just standing there, and you go, uh-oh, I see something going on in your stomach. And I'll tell you the other way, if it's rotated in and like this, you're seeing the backside, that's a thyroid issue. So you just pick these things up over time.
Also, it can manifest on either side of the body, but often it'll manifest in the same side of the body as the organ that's involved. So the stomach is on the left side of the body, and a lot of the symptoms will manifest on the left side of the body first, but they could be either.
Yeah. Okay. Okay, so here again, the nutrition, we talked about that, B6 on this one, and they said organic iodine for sinusitis, meridian association stomach, upper cervicals, the rib number 1 and first thoracic. Okay, so, and then again, back our T12 and our L1, our stomach, and then our sinuses are the visceral again. So we're seeing some the same thing. All right. Okay, so that's all I got on that. So you can see, again, from our point of view, and I just wanted to give you some of the stomach ones because I wanted you to see the common pattern, the common theme. But you just have to listen. And if you start becoming aware of the system or start learning Touch for Health, that would be the closest thing I can think of for the lay people to start looking at Touch for Health. Great. Talks about the basic muscle testing, shows you the meridian, it gives you the nutrition, talks about the organs, fantastic. And there's even a great wall chart that we have. It's wonderful. It has all the meridians, the muscles grouped on there. It's great. But there's a book that goes through it, all of those. It's really comprehensive. But you'll see from our point of view, things aren't that mysterious. Things just don't happen. It's not just like a virus sneaks up on you or cancer snuck up on you and got you. These are things that we build. These are distortions that go over time. These are related to emotions that get bottled up and stuffed away over time. And, we're humans and we're complicated. But as you start to, you probably have heard people say, peel the onion, untie the knot. It all starts to unravel in a good way. You know, if you find the stomach, you're looking at the first part of digestion. And if you can start handling that, then everything is better under, you know, after that. Then your gallbladder stuff will get better. Your small intestine stuff will get better. Your SIBO will get better. Your Crohn's will get better. Your Hashimoto's will get better because you're able to digest. The very first phase of you know, putting something in your mouth, other than chewing it, it's got to go in your stomach and you have to digest it. So that's really powerful, being able to look at that and see that and to know that you can fix that. And not be, I would say it should take some of the pressure off of just things happening that you don't know of. There's always a reason, you know, and we can easily track stuff down. And if you can track it down, then you can fix it. So if you find it, you can fix it. Cool.
So I hope you're able to digest all this information on the stomach. It's really important to make these correlations because it affects so many people and so many symptoms. We saw all the muscles related to that, and a lot of pain and debilitation that they have could be easily remedied by to start to address, in addition to all the basics with the environment. That, you know, are you eating gluten? Are you combining your food properly? Do you chew your food well enough? Do you eat when you're upset? Are you doing business on the phone? Are you watching the news while you're eating? Stuff like that. You know, it all affects the function of the stomach. And if you're pissed off, somebody, you just can't, I can't stomach them. They make me sick to my stomach. So those emotional overrides, levels that affect all that, that all has to be addressed and put into the equation. But,
yeah. And not assimilating and not digesting things in life. You know, what is it that you can't stomach, you can't hold down, that you just don't want? You want to just regurgitate out. You know,
you bite off more than you can chew.
Yeah, you're not adapting to something, right? Right.
So there's a lot to those old expressions. But it's cool that you can zero in on it. The body will give you that information if you know how to communicate with the body through applied kinesiology, muscle testing, and then using the frequencies on the table. It's amazing how quickly you can undo these imbalances and then just make your corrections. It saves so much time. And it's exciting to have those tools to work with now, which we didn't have for decades. So I hope you assimilated all this and can digest it and put it to use. And thank you for joining in.
Yep, and I hope that you all can get a little bit of this and see how we can simplify so many type of problems. So we have something that's, you know, that can manifest as TMJ issues, clicking. You know, you saw all those muscles. You can see something, you know, like in the hand, you know, our carpal tunnel, and we see how the neck can all be related to just one thing, something that you can or cannot stomach. So from that, we can start to unravel it. And I hope that gives you some empowerment. And I guess that's all for us today. Thank you for watching and sharing. Watch our other videos on our Two Bros Healing, and check out our website, twobroshealing.com. And we'll see you next week.
Namaste.
Namaste.